Here at Cape Dental Care, we really specialize in full arch dentistry. Full arch dentistry, believe it or not, starts with traditional dentures. And at our lab, we create beautiful, lifelike dentures. They can look and feel great, but essentially dentures are just resting on top of the gums. They just kind of rest there, and so they can move, they can get food caught underneath them, they can develop sores, and the bone continues to resorb long-term underneath dentures. For those who are not satisfied with a denture, there are many levels of dental implants, and they really fall into two categories. One is removable, something that you snap into dental implants that you take in and out, and also fixed, ones that you do not take out of the mouth, that are screwed in place and are more of a permanent solution that feel more like their natural teeth. Some patients have pretty much comfortable dentures. They get by pretty well with them, but they want a little bit more stability. In that case, we'd recommend a couple dental implants to snap in the dentures so they can continue wearing their dentures that they're happy with, but with a little bit more stability. For those who are unsatisfied with something that they have to remove in and out of their mouth, we recommend full arch treatments. And the more aesthetic a material is, oftentimes the weaker it becomes. And the stronger it is, oftentimes the less aesthetic the material is. And so we need to find a balance there. The first option, the most common option, is an acrylic fused to metal implant supported bridge, often called the hybrid bridge or the all-on-4 bridge. It's our most common because it is one of the most aesthetic materials that we have. The second option is a little more strong. It's called a zirconium, full arch zirconia bridge. It's very chip resistant, it can be very aesthetic, it's a beautiful restoration. And the third option, which is the top of the line, that is what we call the thimble bridge, or some call the crown and frame bridge, where we can individually place implants on top of a metal frame. And we can do whatever we want with those crowns to make them look as beautiful as possible. And it's the longest lasting, most aesthetic restoration that we can do. We know what it takes to deliver the best care at all times, all different types of patients, all different types of cases. We've seen it all, and we can provide every single level of care that we need to make every patient experience excellent.